Zika virus is an communicable disease, vector-borne disease. Mosquitoes, look at this. Zika virus, mosquitoes bite and suffer from congenital problems. Look at this. Detail going on. Introduction. Zika virus is a mosquito-borne flavivirus, first identified in Uganda in 1947 in rhesus monkeys. It was later detected in human in 1952. Over the past decade, Zika virus has emerged as a significant public health concern due to its association with severe birth defects and neurological complications. The virus is primarily spread by Aedes mosquitoes, which are also responsible for the transmission of dengue and chikungunya virus. Definition. Zika virus is a positive sense single stranded RNA virus belonging to the flaviviral family. It causes a disease known as Zika fever or Zika virus disease, which is generally mild in adult but can have serious consequences in pregnant women, leading to congenital abnormalities. Types. Zika virus does not have different types or strains that are commonly recognized like other virus. Example, influenza. However, it is classified into two major lineages. One African lineage, two Asian lineage, responsible for the recent outbreaks in the Americas and Southeast Asia. Causes. Zika virus is primarily transmitted to human through the bites of an infected Aedes mosquito, particularly Aedes aegypti and Aedes albopictus. Other modes of transmission include 1. Vertical transmission from pregnant woman to her fetus. 2. Sexual transmission through unprotected sexual contact with an infected person. 3. Blood transfusion. The rare Zika can transmitted through infected blood. 4. Laboratory exposure. Accidental exposure in laboratory setting has also been reported. Risk factors. Several factors increase the risk of contracting Zika virus. 1. Living in or traveling to areas with active Zika transmission. Tropical and subtropical regions, particularly in Central and South America, the Caribbean and Southeast Asia. to unprotected sexual activity with a partner who has traveled to or resides in an area with ZIKA virus transmission. 3. Pregnancy. Pregnant women are at risk of transmitting the virus to their unborn child. Complications. Zika virus can lead to serious complications, particularly during pregnancy. 1. Microcephaly, a severe birth defect where a baby is born with smaller than normal head due to abnormal brain development. 2. Congenital Zika syndrome, a range of birth defects associated with Zika infection during the pregnancy, including brain abnormalities, eye defects, hearing loss, and impaired growth. 3. Guillain-Barré syndrome, a rare neurological disorder where the body's immune system attacks the nerves, leading to muscle weakness and paralysis. For other neurological complications such as myelitis and meningoencephalitis. Pathophysiology. The Zika virus enters the body primarily through mosquito bites. It infects and replicates within various cell types, including dendritic cells, fibroblasts, and keratinocytes. The virus then spread to the lymph nodes and bloodstream, resulting in viremia. In pregnant women, Zika virus can cross the placental barrier and infect the fetus, leading to damage in developing neural tissues, which may result in microcephaly and other congenital abnormalities. The exact mechanism of how Zika caused these conditions are still under investigation, but are believed to involve apoptosis, programmed cell death, and disruption of cell signaling pathways, crucial for fetal development. Step-by-step process, the disease, pathophysiology. 1. Viral entry by mosquito bites. 2. Initial infection and local replication, infection of skin cells, viral replication. 3. Spread to lymph nodes, infection of lymph nodes. 4. Viremia, virus in the bloodstream, systemic spread, symptoms onset. 5. Infection of various organs, crossing the blood-brain barrier, crossing the placenta and other tissues. 6. Immunoresponse, activation of immune cells, cytokine release. 7. Apoptosis and tissue damage, cell death, inflammation. 8. Resolution or chronic infection, resolution, chronic or latent infection. 9. Complications, neurological complications, congenital Zika syndrome. This step-by-step process outlines the pathophysiological mechanisms by which Zika virus causes disease, highlighting the critical points where the virus interacts with host tissues and the immune system, leading to clinical manifestations. Signs and symptoms. Zika virus infection is often asymptomatic or presents with mild symptoms which typically appear 2 to 7 days after exposure. The most common symptoms include 1 fever, mild and low grade, 2 rash, maculopapular spreading from the face to the rest of body. 3. Joint pain, especially in the hands and feet. 4. Conjunctivitis, red eyes, non-purulent and bilateral. 5. Headache, mild to moderate in intensity. 6. Muscle pain and fatigue. Generalized body ache. Diagnosis. Diagnosing Zika virus infection can be challenged due to its overlapping symptoms with other arboviral disease like dengue and chikungunya. Diagnosis is primarily based on clinical evaluation, assessing the symptoms and history of travel or exposure to areas with active Zika transmission. Laboratory test including 1. Molecular test RT-PCR detect viral RNA in blood, urine or other body fluids during the acute phase or infection. 2. Serological test IgM and IgG antibodies detect antibodies against Zika but cross reactivity with other flaviviruses, example dengue, can occur, complicating interpretation. Nursing diagnosis. Nursing diagnosis for patient with Zika virus may include 1. Acute pain related to joint and muscle pain. 2. Impaired skin integrity related to rash. 3. Risk for infection related to exposure to infected mosquitoes or other modes of transmission. 4. Anxiety related to concerns about the disease, especially in pregnant women. 5. Knowledge deficit related to the understanding of disease transmission and prevention. Management of Zika virus infection focus on supportive care as there is no specific antiviral treatment. 1. Symptomatic treatment includes rest, hydration and medication such as acetaminophen to relieve pain and fever. Non-steroidal anti-inflammatory drugs should be avoided until dengue infection is ruled out due to the risk of bleeding. 2. Monitoring regular follow-up, especially for pregnant women, to maintain fetal development and detect any complications early. 3. Psychosocial support, counseling and support for affected individuals and families, particularly those dealing with congenital ZIKA syndrome. Treatment. There is no specific antiviral treatment for ZIKA virus. The treatment is mainly supportive. On pain and fever management using acetaminophen, aspirin and other NSAIDs should be avoided to prevent hemorrhagic complications. Two, hydration, encouraging fluid intake to prevent dehydration. 3. Rest, advising patients to rest to help the body fight the infection. Psychosocial medicine. The psychological impact of ZIKA virus, particularly on pregnant women and families with children affected by congenital ZIKA syndrome, is profound. It includes 1. Psychological distress, anxiety, depression and fear about the health and future of the unborn child. 2. Social stigma. Families may experience stigma and discrimination due to the visible effects of congenital ZIKA syndrome. 3. Support service, access to psychological counseling and social support and community resources is crucial for affected families. Prevention. Preventing ZIKA virus infection focus on reducing mosquito exposure and transmission. 1. Mosquito control using insect repellents, wearing protective clothing and eliminating standing water where mosquitoes breed. To travel advices, avoiding travel to areas with active ZIKA transmission, especially for pregnant women. 3. Safe sex practices, using condoms or abstaining from sex with partners who may have been exposed to ZIKA. 4. Blood donation screening, ensuring that blood is tested for ZIKA before transfusion in areas with active transmission. In conclusion, ZIKA virus poses significant public health challenges, particularly due to its potential to cause severe birth defects and neurological complications. While the infection is typically mild in most individuals, the risk for pregnant women and their fetus make ZIKA a critical area of concern. Prevention through mosquito control, safe sex practices, and travel precautions remains the most effective strategies. Continued research and public health efforts are essential to better understand, manage, and prevent the spread of Zika virus. Thank you. Have a nice day.